Hello, I'm Dr. Andrew Smith, a clinician scientist at the University of Alabama at Birmingham, and I'm going to provide an example of the broad impact of kidney cancer research. I personally lost my brother to advanced kidney cancer, and we've all lost someone to cancer. I've dedicated my life to fighting kidney cancer through research and clinical care, and I'm excited to share some of our recent developments with you. I've studied kidney cancer for about 15 years. Kidney cancer is an ideal tumor to study as it's highly vascular and responds to antivascular therapy. It makes a great model for other cancers. This is an example here of kidney cancer before therapy on the left and after therapy on the right. Notice how the tumors don't really shrink in size but are less vascular. This led us to ask the following research question. Can we measure tumor devascularization and predict kidney cancer response to antivascular therapy? We developed software to measure the vascular tumor burden, or the amount of vascularized tumor, and we were able to predict tumor response better than any other current method. The vascular tumor burden is shown in red here. You can see in this example where there are multiple different tumors before therapy and then after one cycle of therapy. The tumors only shrink by about 12% in terms of size, but they decrease by 63% in terms of the vascular tumor burden. It turns out that this imaging biomarker works extremely well and can be applied to many other tumors, but we first wanted to study it further in kidney cancer. We received a grant from the Department of Defense Congressionally Directed Medical Research Programs, specifically from the Kidney Cancer Research Program. In total, we received $450,000. This allowed us to continue our research and provided support for multiple employees at UAB. As we conducted this research, we realized that we were creating something rather amazing that would impact all forms of advanced cancer. Let's take a look at how we evaluate advanced cancer using current methods. You see, patients with advanced cancer of any type undergo repeated imaging to determine if therapy is working or not. Radiologists like me are medical doctors that interpret these images. The colors around the images on the left here represent the different radiologists that interpreted these CT scans. Radiologists dictate text-based reports, as you see here on the right. But these reports are suboptimal and prone to errors, and they don't display the information in an ideal way. It can be hard for oncologists and patients to read these reports. Building off of the Department of Defense Kidney Cancer Grant, we built an Augmented Intelligence image viewer to help with assessment of advanced cancer and lymphoma. Augmented intelligence refers to the partnership of humans and artificial intelligence working together to improve human performance. We built amazing artificial intelligence algorithms to assist with tumor measurements, tumor labeling, and tumor tracking over time. These were built by labeling 60,000 tumors on CT scans and MRIs. That's more than anyone else in the world has done. We combine these with guided workflows designed to reduce errors and improve accuracy, efficiency, and standardization by adhering to best practice standards. These workflows apply to all forms of advanced cancer, including kidney cancer, lung cancer, colon cancer, breast cancer, liver cancer, melanoma, and lymphoma, just to name a few. The Augmented Intelligence platform then generates advanced, meaningful reports with a graph, table, key images, and structured text. We'll come back to these in a bit. Let me give you a quick demonstration of the software. This is an augmented intelligence imaging platform designed for advanced cancer response evaluation and reporting. With a single click, the AI measures this target lesion. A second AI algorithm then determines the tumor location to be verified by the radiologist. The AI-assisted tumor measurements and labeling work anywhere in the body. The measurements labeling are easy to edit on zoomed images, and the radiologist never has to take his or her eyes off of the images to check for dictation errors. The system is designed to prevent errors and improve accuracy, efficiency, and standardization. There's no longer a need to dictate text reports. Instead, the radiologist is guided through the workflow and leverages AI to help with various tasks. The example you are seeing now represents the first CT scan from a patient with advanced cancer. We're able to quantify their total tumor burden by making these AI-assisted measurements. Now we're looking at a follow-up exam. The current exam's on the left and the prior exam on the right. An autopilot feature allows the radiologist to quickly cycle through all findings arranged in anatomic order from head to toe. The user activates autopilot to initiate AI-assisted tumor tracking. The radiologist clicks on the target lesion on the current exam on the left to measure it. There's no need to relabel since the name is retained. Autopilot rapidly cycles through all remaining findings. The radiologist is actively in control of this semi-automated process. We wanted to make sure that the human retains control of the process. The workflow provides all the necessary tools to make sure that nothing is missed and to eliminate errors related to data transfer. There's no need to dictate with this system, and all data is digitized. The digitized data is then transferred directly into the advanced reports, and mathematical calculations are automated. At the conclusion of the image evaluation, automated reports are generated in less than half a second. The graphical report displays all relevant information, including individual measurements and percent changes in tumor burden. A complementary table, key images, and structured text are also available. Collectively, the Augmented Intelligence guided workflows generate crystal clear reports and improve communication. As all of this data is digitized, we can translate these reports into any language, which can help with underrepresented groups in the US, but this also helps us move towards global distribution. But does this system reduce errors and improve accuracy, efficiency, and standardization? In a landmark multi-institutional trial with 24 radiologists and 20 oncologists, comparing the Augmented Intelligence workflow and reports to current practice methods with dictated text reports, the Augmented Intelligence workflows and reports increased accuracy by 25%, reduced major errors by 99%, were 2 times faster for radiologists, and increased inter-oncologist agreement by 58%. In a post-study survey, 96% of radiologists preferred the AI-guided workflow, and 100% of oncologists preferred the advanced reports. In this example, the Augmented Intelligence guided workflow and automated reports for advanced cancer response to therapy established a new standard of care, and FDA clearance is anticipated in January of 2021. In 2019, we formed a new technology startup company in Alabama called AI Metrics. We recently raised $1.7 million from the Alabama Capital Network, bringing our total raise to $2.4 million. This multi-million-dollar Birmingham startup is now hiring employees and distributing our technology on a global scale. All of this started with kidney cancer research. Notice that the logo of the KidneyCAN shows multiple different colors. I interpret this to represent how kidney cancer research can impact multiple other cancers and have a broad impact on health. I hope this talk helps you see how congressionally directed medical research programs, specifically the kidney cancer research program, can broadly impact all forms of cancer and provide a return on investment from these important taxpayer dollars.